One other that comes to mind is symphytum, and that is with any broken bones, and it helps to mend the bone, to actually help the weave back together. And so in addition to, of course, other things that are done at the same time to facilitate the mending, like vitamin C and micronutrients and all that, to give somebody symphytum can just facilitate the process. So,
and I will give props to Western medicine for trauma and broken bones. That's where they exceed and excel. You know, that is, you're going to go in and get your bones set.
Yeah, I would say if you break your arm, you don't go to your naturopath
to get a homeopathic remedy.
However,
yes,
once it's set, I would avoid the painkillers and the NSAIDs that they give you at the same time that they set your bone.
Right.
And go to these other things that get rid of the pain by just fixing the underlying issue.
Yeah, so let's launch into that discussion on pain.
Around pain. So pain, of course, is all kind of wrapped up in trauma, but I think a different approach is with us. In the conventional world, they take care of pain by blocking the process that leads to the pain, which is the inflammation, which we've talked about. So you give cortisone, and that gets rid of pain by stopping the inflammatory process, stopping the healing process. In our world, we're looking to kind of separate pain from the healing and address pain individually without interfering with that healing process that's going on underneath. And so there are a number of therapies that we're going to think about to just help control that pain. And a lot of those we've already talked about with the acupuncture and Chinese herbs. There are vitamin C in high doses with connective tissue damage. Vitamin C in itself can be very effective in controlling pain. There are a number of botanicals that might be appropriate depending on the nature. It could be hypericum, can actually help with kind of nerve-like pain. Could be, kava as kind of a nervous system, relax the nervous system.
Turmeric.
There's a lot of turmeric, absolutely, anti-inflammatory. But the important, and acupuncture, of course, we talked a lot about that. The important thing to note is that in using these things, we're not preventing the body from recovering, and in fact, we're facilitating the recovery. It's just that we're also addressing the pain so that people can be functional.
You know, one word on non-steroidals, aspirin, Advil, Aleve. You know, what I think a lot of people don't realize, runners, I always hear, oh, well, I just take these preventatively before my run so I don't hurt after. What they don't realize is there's a negative repercussion of that, is that it stops your cartilage from healing.
Yeah.
And so it's actually stopping a physiologic process of healing of your body. And so you're actually creating more degeneration. You just don't feel it the next day.
I mean, cortisone is the worst. It actually breaks down connective tissue.
Right. So you can only get so many cortisone shots because of that negative piece of it. And that's really where we're saying, I think we need to have a different approach here, because we're creating chronic issues, which we've already, that's what all of the other podcasts have been about. Yeah. So here's our acute intervention of trying to prevent some stuff from happening.
All right. I think we should wrap it.
Lovely.
First vodcast.
Lovely.
I think went all right. Next time we'll maybe try to do a little dancing and then keep it a little more lively. What's our topic next time? Do you know? Yeah, I don't remember either. We got it all mapped out, but I don't remember. But, however, we do want to encourage people, if you have questions, please send them to questions@naturecuresclinic.com. And keep checking out our website. We keep adding more things to the website. We just added forums to the website, and those will be growing soon. We are adding video now to the website. Lots of things coming onto the website. So always visit. And let's say questions at Nature Cures Clinic. And if you have topics that you would like to have us address, also send those along to the same address, and we'd be happy to put that in the queue and maybe talk through those things.
And any comments about the new format and along those lines.
Yeah.
Thanks for watching.